Hi, welcome back to Medicare 101. This video series walks you through the basics of what Medicare is, how to enroll in Medicare, different paths that you can take in Medicare. Today's video, we're talking specifically about Medicare Part D, which is your prescription drug coverage. Once you're enrolled in Medicare Parts A and B, you can get a Medicare Part D prescription drug coverage to help cover the cost of your prescriptions. Original Medicare does not cover prescription drugs except in specific circumstances. So, prescription drug coverage is provided through insurance companies and can range in value and cost. While Medicare Advantage plans will sometimes include prescription drug coverage, that is not always the case. If you choose to get a Medigap plan or a Medicare supplement, you will need to get a standalone prescription drug plan. While we don't discuss specific prescription drug plans in this video, we will discuss the things that you need to look for in your prescription drug plan. Each prescription drug plan has what is called a formulary. This is a list of medications that are covered under each specific plan. The medications are split into tiers, which designate how much you have to pay for each medication. Tier one is usually the lowest tier and represents the lower cost medications. The higher the tier, the higher the cost. Most prescription drug plans will have a set copay that you will be responsible for paying depending on what tier the medication falls under. You may also be responsible for a deductible for medications within a certain tier. Finally, all prescription drug plans are required to limit the maximum out of pocket expense. This maximum out of pocket expense is subject to change. However, once this limit is reached, the cost of your medication must be fully covered by your plan as long as it is on their formulary. The most important thing to remember when choosing a prescription drug plan is to make sure that the medications you take are on their formulary or on their list of covered medications. You should review this list with your Medicare professional both before you enroll in a plan and on an annual basis because these are subject to change. Their formularies change from year to year, new drugs come in, old drugs drop out, just depending on what their formulary shows. So it's very important that you review that at least on an annual basis when the plans change year to year. Again, we highly recommend you walk with a Medicare professional as you're going through this process. It makes the process so much simpler. If you have friends and family in your area that work with somebody, use somebody local. We are all for local uh, working with local people and helping local people out. If you're in the Amarillo area in Amarillo, Texas, we would love to work with you. If you don't have somebody local, though, we are licensed in several different states and contracted with many companies. We would love to work with you. And if we aren't licensed in your area and contracted with companies in your area, we're happy to connect you with somebody who is.